Hey folks, this is Amber Insight. I'm Zori Amber, she, her pronouns. If you're new here, welcome. If you're not new here, welcome back. And this is part of a multi-part series where I talk about different mental health professions. Hopefully this will be an opportunity for those of you who are interested in a mental health career to learn about the different trainings, the different professions, and what they do. And don't forget to like and subscribe. That really helps me out, and that helps get my videos out to other people who may really need this information. Well, enough with that. Let's get started. So today we're going to talk about social workers, which is one of the oldest mental health fields that has been around, public policy fields that has been around. And there's so much diversity in this career. And I'm really excited to talk about it. It's a lot more diverse than I thought before I initially researched. And I think it's really interesting, and I hope you think it's really interesting as well. So social workers work to enhance human well-being and help meet basic and complex needs of all people. Social workers often work with oppressed and vulnerable populations. One thing that makes social work different from other mental health professions is that social workers not only work with the person, the client, but they also work with the environment as well. Essentially, social workers help their clients and the communities that they live in learn how to cope with their reality in healthy ways, and also learn ways to create positive change in their community. As always, with the mental health professions, some of this overlaps with what other mental health professionals do, such as providing therapy. Social workers also conduct assessments, research, advocate for resources for their clients, communicate with their clients' care teams, provide crisis intervention, refer their clients to appropriate treatment centers, and social workers make sure that their clients' case records and files comply with policies and regulations. So one of the really cool things that I found out about social workers, like any other mental health professions, is there are many different types of social workers. There are social worker administrators, social work advocates, social workers who work with older adults, child welfare social workers who work with children with developmental disabilities, healthcare social workers, international development social workers who work with justice and corrections, mental health and clinical social workers, substance abuse social workers who work with occupational and employee programs, social workers who work with policy and planning, social workers who work with politics, social workers who work with public welfare, social workers who do research, and school social workers. So obviously, some of these types of social workers overlap with each other. There may be social workers who work in multiple fields of these areas of social work, but I think it really helps shows the diversity of the social work field. Another really interesting and important part of social work is the training. So unlike in other fields where you need at least a master's to call yourself a professional in that field, such as needing a master's in clinical mental health counseling to call yourself a clinical mental health counselor, social workers can have a bachelor's in social work to call themselves a social worker. For social work, you don't necessarily need a bachelor's in social work to become a social worker. However, if you are able to get a bachelor's in social work, then you're able to apply for entry-level jobs once you get your bachelor's in the field of social work. One of the benefits of having a bachelor's in social work is that you may have the ability to enroll in advanced standing programs in master's of social work programs. Basically, what that means is that instead of the full 2 to 3 years that it would take to get a master's in social work, it may only take you 1 or 2 years to do that process. So it shortens up the time because you've already taken the foundational classes of social work. Also, with a bachelor's in social work, you can start at entry-level job positions in the social work field. However, most people move on and get a master's in social work because it opens up the opportunities for them as a social worker, and the pay is a lot better. So when you're applying to any social work program, you want to make sure that it's accredited by the Council on Social Work Education. Similar to other accreditation bodies that we talked about, like KCREP, it's just a organization that makes sure that the standards of social work are held high and that all programs are following that, making sure that students are getting the quality education that they need to succeed in the field. And also it makes the licensing process a bit easier. So once you get your bachelor's, whether that's in a bachelor's in social work or not, then you can apply for a master's in social work. A master's in social work usually takes about 2 to 3 years of full-time coursework to complete. And a master's program in social work usually requires a minimum of 900 hours of supervised practice. Courses for a bachelor's in social work includes social service delivery systems, foundations of social work practice, micro-human behavior in the social environment, social work practice, research methods in social work, statistics for social work, macro-human behavior in social environment, diversity and oppression in the social work context. Again, like I said, you don't need to have a bachelor's in social work to become a social worker, but some of the courses that you take in a bachelor's in social work program are the courses that you would take in a master's in social work program. And by taking them early in a bachelor's program, you can cut the time that you would need to spend in a master's social work program, sometimes by half. Courses for a master's in social work program sometimes includes Introduction to Social Work, Substance Abuse, Human Behavior in the Environment, Death and Dying, Field Study, Dynamics of Racism and Oppression, Assessment and Diagnosis, Couple and Family Therapy, Strategic Planning for Nonprofit and Public Organizations, and Social Work for Older Adults. If you're ever unsure about which level of social work you want to do, bachelor's versus master's versus doctorate or PhD in social work, here's the breakdown. Bachelor's in social work allows you into entry-level positions such as aging services or residential treatment. A master's in social work is typically what most people do. If you're interested in becoming a licensed clinical social worker, then you need a master's in social work. Licensed clinical social workers, or LCSWs, can provide one-on-one psychotherapy or deliver advanced clinical services. To become a licensed clinical social worker, you need to take an exam by the Association of Social Work Boards, which again, that requirement looks different state by state, and you need at least 2 to 3 years of supervised practice before you can become fully licensed. People with an MSW also may be interested in program management, having a supervisory position in social work, or they may work in politics dealing with social justice matters. So another interesting thing that I found about the social work field is apparently there's 2 different types of doctoral degrees that you can choose from. There's first the Doctor of Philosophy in Social Work, which is good for those who want to become a professor or academic researcher. The Doctor of Social Work, or DSW, which is good for those who want a career in leadership and administration outside of academia. Those who have a DSW or PhD in social work are qualified to teach at the university level and hold high-level program or systems management positions. A DSW or PhD in social work takes about 3 to 6 years of full-time coursework to complete. The coursework for a DSW versus PhD can look different. For DSW, coursework looks like social theories and their relations to clinical practice, implementing evidence-based and evidence-informed practices, neuroscience for clinical practice, psychopathology and psychopharmacology, and critical analysis of clinical practices. The PhD coursework can look like quantitative scientific methods, survey of research methods in social and behavioral sciences, integrating public policy and outcomes into social work research, doctoral teaching practicum, and dissertation direction. Another way to think of it is that those who have a PhD in social work are interested in clinical research, clinical practice, and advancing the social work field through research and teaching, while a DSW are interested in practicing at the leadership level and management level, and who are also just interested in expanding their expertise in the field. So yeah, there's a lot of really amazing areas of work that social workers do, and it can look very different depending on your interests. Part of that reason could be that social work is one of the oldest professions in at least the US. So they probably had a lot of time to focus and to expand on things compared to other fields. So I don't know about you, but that was a lot. So let's review. So there are 3 different levels of social work: a bachelor's in social work, a master's in social work, and then either a DSW, which is a doctor of social work, or a PhD, which is a doctor of philosophy in social work. BS in social work allows for entry-level positions such as aging services or residential treatment. And the benefit of the BSW is that you may have the ability to enroll in advanced standing programs for an MSW degree, which means it may take you a shorter amount of time to complete your MSW compared to if you didn't have a bachelor's in social work. An MSW is needed if you want to become a licensed clinical social worker, or LCSW, to provide one-on-one psychotherapy or deliver advanced clinical services. It's also good if you want to do program management, have a supervisory position in social work, or work in politics dealing with social justice matters. And a DSW or PhD in social work allows you to be qualified to teach at the university level and hold high-level program or systems management positions. So again, social workers work with individual clients and also their communities to help promote healthy coping strategies, and also to provide resources for their clients and the communities to be able to create actual systemic change. There are really a lot of different areas in social work, so I really encourage you, if you're interested in going into a social work program, to look to see what areas that social work program focuses on. Like any sort of mental health program, master's level program, or doctoral level program, it's just always important to make sure that what you're interested in doing is what the program will train you for. And also make sure that the program is a good fit for you. So I hope that was helpful. I hope that was insightful. Again, let me know what you thought. Was this helpful? Are you interested in looking into social work? Or are there other mental health professions that you're interested in learning more about? Remember, as always, to like and subscribe if you haven't already. Hit the bell button so that you can receive notifications of my next video. Don't forget to put in the comments if there's another mental health profession that you want to really know about. And I'll see you next time. Bye.